Raywat Deonandan is an epidemiologist and professor in the Faculty of Health Sciences at the University of Ottawa and joins us on the line now. Good morning.
Good morning. How are you?
Very well, thanks. How effective would you say temperature checks are when it comes to identifying potential cases of COVID-19?
I see this as a low-risk, very low-reward scenario. So first of all, a lot of people, as we know, are asymptomatic before they develop symptoms, but they're still virally shedding. So we won't catch those people. They haven't got a fever yet. And in fact, one estimate from the Medical Association suggests that up to 2/3 of seriously ill people don't ever get a fever. So we're not going to catch a lot of cases. Add to that the issue of the kind of thermometer being used. I assume it's going to be a no-touch thermal scanner of some kind. And so if it's not done by a professional, you're going to have a lot of sensitivity and specificity issues as well. The fever could also mean a head cold or appendicitis. And some people who are, in fact, sick might be taking Tylenol or some other over-the-counter drugs to suppress their temperature. So all in all, I don't think it's that useful. It's of marginal utility, but it is one tool in a greater flotilla of public health tools we can deploy to increase confidence and maybe catch some cases.
Do you worry that it might give people a false sense of security if they, pass the temperature test and then they go into a store and they think, oh, well, I'm fine, and then they don't practice physical distancing as well?
That has to be a concern. And the way I look at it, though, is we want people to be a little less panicky these days and to trust their fellow citizens a little more than they have been in the last couple of weeks now that we've got the caseload down to something a bit more manageable. So I see it as maybe instilling a bit more confidence to be out, while at the same time not diminishing your guard. So social distancing must remain the number one technique that we use to slow transmission. Wearing masks is good as well, but the distancing is the best part. So if you see a check station checking temperatures before entering a facility of some kind, you're going to be reminded that the pandemic is real, first of all, and you may take it more seriously. So both things are going on simultaneously. On the one hand, you might be having a false sense of confidence. On the other hand, at least you've got some confidence. Overall, though, my biggest concern is if someone does test positive in a temperature check, what does that mean? Are there resources, implications for public health to now step in and help that person? Is there stigmatization involved? So these are all issues that have to be worked at a management level.
Well, that's a good point. I mean, if somebody does have a fever, they test for that when they have their temperature checked and they're trying to board a plane or get groceries. What should happen next?
Right. So ideally, from an epidemiological perspective, public health should arrive and interrogate that person further. And the word interrogation sounds intimidating, but what I mean is investigate further to see if other symptoms are there so we can maybe rule out the possibility of COVID or rule it in. And if we do rule it in, we have to do some contact tracing and isolation. So in the case of an airport, it's unclear how that would work. So would the person now be denied boarding? Would everyone in the gate area have to be set aside and tested as well because they've now been exposed to a possible case? These things have to be really thought out well. And a simple temperature check is not sufficient in my mind to garner the kind of confidence needed for that approach. So we'll have to add to it some other tools, like have you have a history of exposure, like do you have these other symptoms as well. So this is a moving target, obviously, a lot of moving parts in this. And as it unfolds, we're going to have to see more public health investments applied to this sort of strategy. I know Emirates Airlines actually recently tried to test everyone on site using a blood test before boarding a plane. And, the test they used wasn't very good, but there was no plan there for what to do if someone tested positive. You might have had to quarantine the entire airport. So it has to be better thought out, in my opinion.
Yeah, and when you say public health should arrive, I mean, the first question that comes to mind is, do we have the resources for that to happen? You're at a grocery store. Who knows? Maybe more shops will start picking up this technique. All of a sudden, you're getting calls from all over the city saying, well, we're just going to keep this person here until public health arrives. I mean, is that even feasible?
No, that's not feasible. I think a more workable solution would be a person is informed that they have a risk factor and they should be sent to the appropriate information source, like the online self-assessment tool. Maybe set up a kiosk in the corner where someone can actually enter in their information to see if they have other risk factors. Then quietly sent home without garnering too much attention because we don't want to stigmatize people. And then I think we should have a mobile testing capacity where a public health van of some kind is sent to your home and you're tested safely and privately, and no one else needs to be exposed. That's a low investment sort of solution, and other countries are doing it already. We could do it too.
Of course, this takes us back to just testing as a whole in the city, in this country. Experts are saying that more of it just needs to be done before we can really be confident. How close are we to getting more widespread testing done?
We're not as close as I would like. We should be there now. And, there are a lot of fingers to be pointed and a lot of blame to be accepted from a variety of corners. But what we need is, of course, more testing kits and more different types of tests, not just the swab, but also the serology, blood tests, and the antibody tests. We need at-home testing. We need mobile testing. We need rapid on-site testing of the type where if you enter a hospital or a place of business, you can be tested as you enter and have a result within 5 minutes and to know whether or not you were safe to enter. So the ideal scenario is we have these very safe zones that we know everyone in there is not transmitting the virus. And in that way, we do identify a case or an outbreak, we can swoop in with overwhelming public health resources and quash an outbreak before it becomes an epidemic. That's the goal. Because as we reopen the economy, we're going to have a few cases here and there. It's unavoidable. The challenge is, can we prevent those handful of cases from becoming outbreaks, and can we prevent those outbreaks from becoming epidemics? That is an administrative challenge. It's not a medical one. So we are transitioning now the pandemic from a health crisis more to a health systems crisis, and increasingly to a management crisis. And what we need are resources and administrative wherewithal.
Those rapid tests that you're talking about, that you can get a result in 5 minutes, how close are we to those?
You hear these rumors all the time from laboratories. The Abbott test supposedly could get a result within 10 or 15 minutes. The Spartan Biosciences test supposedly could have had a result in 30 minutes or so. I hear rumors in South Korea they have a 5-minute test. I'm not sure how true that is. And it varies. And it's unclear what the environment and the characteristics of the population need to be for that rapid turnaround. But the science is moving so fast, and our biosciences sector, this is their number one priority right now, so I have a lot of confidence we can have a 15-minute test on the ground in situ within a month or so. So I can't answer your question directly to know exactly how fast it is, but monitoring the publication rate and the rumors coming out of various laboratories, I think we're getting there.
Do you think Ontario is opening too quickly?
Well, not really. I prefer that we wait a few more weeks. My personal threshold is if the percentage of tests that come back positive is about 1%, I feel more confident. Right now we're at about 5%. So when we do open, it has to be in a staged format, and luckily everybody's on board with that. You start with the least risky endeavors, like the outdoor activities, like construction and landscaping. And then you have to figure out who's the most vulnerable. We still don't really know who the most vulnerable are, and we leave those people for last. And we start with the least vulnerable, the young, the fit, etc. So to answer your question, are we opening up too fast? I err on the side of caution. I'd rather have a few more weeks, but if we have to open up, we're doing it the right way.
Good to talk to you today. Thanks so much.
Thank you.
That's Raywat Deonandan. He is an epidemiologist and a professor in the Faculty of Health Sciences at the University of Ottawa.